name is Dr. Anna Trujillo, and I'm a first-year emergency medicine resident at St. Mary Mercy Hospital in Livonia. I will be presenting today with Seraj Farhat, one of our MRAP students. We will be discussing our study on racial disparities with respect to infection, hospitalization, and mortality from the SARS-CoV-2 pandemic. As we know, COVID-19 is caused by the severe acute respiratory syndrome disease coronavirus 2. The reason we decided to study our topic today is because research has shown that inequities in the social determinants of health, such as poverty and healthcare access, are more commonly found in racial and ethnic minority groups. There is an increasing awareness of disproportionate burden amongst racial and ethnic minority groups affected by COVID-19.
Awesome. So for the design of the study, we obtained data using a retrospective analysis, and we did this by creating a multi-system model from the Trinity Health System all across the United States. And this was quite difficult because we had to go through a careful process to actually obtain this data and use it, because it was the first time we've ever done so for Trinity Health. So the study included patients from January 1st to June 30th, 2020, and we collected data on 182,000 patients who were tested for COVID-19. And we were looking for the outcomes of COVID-19 mortality primarily, and secondarily we were looking at COVID test positivity and hospital admissions. For our methods section, we obtained descriptive stats for our demographic variables, and we broke them down in that way. We also used predictive variables to further break down our study. We included things like age, sex, insurance status, income status, body mass index, population density as measured by zip code, and the Charlson Comorbidity Index, which is a measure of disease burden. Some of these are categorical and some of them are continuous. So for the categorical data, we used Pearson chi-squared for the dichotomous variables and independent sample t-tests for our continuous racial variables. We also used logistic regressions to break down adjusted differences between the two, and then where in adjusted differences we can control for these predictive variables mentioned above. Thank you.
As for the results of the study, we have a flowchart as shown here to show you how we categorize these patients. We had approximately 182,000 patients who were tested for the SARS-CoV-2 infection. We broke these number of patients down by race and divided them into white, Black or African Americans, and others, in addition to 25,000 who were removed from the study due to unknown race status. We further broke down the patients from each race and divided them into categories of COVID positive and or COVID negative.
Thank you, Anna. So some of the major alarming results that we actually found from this study were that Black or African Americans were 2.75 times more likely to be infected with COVID-19, and they were also 1.6 times more likely to die from this virus. And these results are further shown in Table 3. It was shown that among Black or African American patients, the percentage of those who were COVID positive was about 13.7, and it was about 4.99 in white patients. We also see mortality results and hospitalization results, and this data will further be talked about in the next slide. Previously, we were talking about unadjusted statistics, but now we're talking about our adjusted stats. And so this means that we are now controlling for the predictive variables that we mentioned earlier on, and we would probably imagine that they have ruled out for some of the differences in mortality and hospitalization. And that is clear when we look at the p-values here that are clearly not significant for mortality and hospitalization. And so what this data tells us is that one or more of the predictive variables used in controlling in the adjusted variables accounted for the differences in mortality and hospitalization. And we will go into that further. These results are a continuation of the adjusted results, although we were only looking at those who passed away from COVID-19. We broke them down by Black or African Americans or white patients, and we observed the clinical and demographic characteristics between them. And something interesting to note was that despite having a similar mortality after adjusting between Black or African American patients and white patients, something very interesting was that Black or African American patients were about 6.3 years younger upon death than white patients. And so this means that there's not an actual equivalence that we can make, because the only equivalency is that the chances of death between 66-year-old patients was the same as the chance of death between 72-year-old patients. And from previous literature, we know that with growing age, the more likely you are to die from COVID-19. And within the specific results that we used, we found that with every year of increasing age, participants and patients are 3.1% more likely to die of COVID-19. So this is extremely impactful data, and it's clear to see that there's an obvious disparity between white patients and black patients in this. And so my colleague will further explain this later on.
To conclude, African Americans were infected much more often and had a greater mortality than white patients prior to adjusting for predictive variables, which were partially corrected. This is a striking and importantly key finding of our study. The higher mortality is likely due to a higher rate of overall COVID infection. Although there are many factors to consider, this could be explained by more African Americans working in essential jobs that result in greater exposure to the virus. Through our data and results, we can clearly identify that the impact on the African American community from the COVID virus has been much greater than on the white population. The fact that mortality was similar after adjusting for comorbidities suggests that by potentially improving the health status through preventative measures such as education on healthier eating habits, diabetes, hypertension, and hyperlipidemia, all which are high-risk comorbidities that African Americans are predisposed to, we can have a positive impact and see a decrease in the health disparities often seen in this community. This can lead to potential avenues for learning how to decrease a differential impact on the African American community in a future pandemic and overall.
Thank you so much for listening to Dr. Trujillo and I's presentation. We hope you've enjoyed. Please leave us any questions if you have them. Thank you.